Dr. Darien joins us now with a question from one of you. This one's from Barry K. How can you tell the difference between a cold and a sinus infection?
I think that's a great question, and to answer that question, I brought a little graphic. You know that I love graphics. I show this one specifically to patients all the time because we know the symptoms of a common cold, but when you have a sinus infection, it often involves your sinuses. Many of them exist in your face, behind your brow bone, behind your nose, in your cheek. On the left side of the screen is a normal sinus. Now that is clear, full of air. On the right side, as you can see, due to a bacterial infection or a viral infection, you have a buildup of fluid that causes that pressure and that pain that so many feel that discomfort with.
Looks nasty, feels even nastier, especially around the eye and the cheekbone. How does it progress? How does it ultimately become a sinus infection and not a cold?
Great question. You know, often it's timing. And so again, these can be due to both viruses that cause the common cold and often bacteria. When it lasts for more than 5 to 7 days, it's more likely a bacterial infection, and that's when you need antibiotics. And then before that, you can do some simple measures at home to help reduce your symptoms.
I mean, is this something you can treat at home, or do you need to go to the doctor?
It is something you can treat at home. You can take some simple steps. I think the first step to be remember is you can take antihistamines. They often decrease that inflammation in the face, and they can help soothe those symptoms. Also, if you think about nasal irrigation, you know, we all have those products at home. Our grandmothers, our grandfathers all use them. They can work. The one thing I'd say is make sure the water you're using with that is clean or sterile to prevent the rare but important risk of an infection. And then also something that my grandmother taught me, using a hot bowl of water. You know, you boil water, you pour it in the bowl, and you put a towel over your head, and you inhale that steam, and that can help you break apart that mucus.
Dr. Grandma, she's always got it.
Always got it. Her and her ginger ale.
Yes, always so good. Thanks, Dr. Darien.
Of course.